Good morning, wherever you are. This is Amara Saul from ConferenceHype. Our segment will focus on liver transplantation for non-resectable colorectal liver metastases, 10-year follow-up and assessment of curative rate in the SECA-II study. From the 2026 August 18 edition of Blood. Background: Eltrombopag combined with horse antithymocyte globulin and cyclosporine A is the standard of care for patients with severe aplastic anemia who are not eligible for stem cell transplantation. Methods: the Eltrombopag for MAA trial is an investigator-initiated, prospective, randomized, placebo-controlled, double-blind, multicenter, Phase 3 trial and compared Eltrombopag plus CSA with placebo plus CSA as a first-line therapy for MAA patients with clinically significant cytopenia. Results: in patients with evaluable response at week 24, the overall response rate, including partial response and complete response, was significantly higher in the Eltrombopag plus CSA arm than in the placebo plus CSA arm. Discussion: the trial was registered as NCT02773225 and at European Union Drug Regulating Authorities clinical trials as UDRA CT 2014-000174-19. From the 2026 August 14 edition of Annals of Surgery. Background: although robot-assisted pancreatoduodenectomy enhances patient recovery, it could be associated with higher costs than open pancreatoduodenectomy, potentially limiting its widespread adoption. Methods: predefined cost-effectiveness analysis in the international randomized DIPLOMA-II trial comparing RPD and OPD in patients with primary resectable neoplasm in 14 centers in 6 European countries. Results: overall, 268 patients were included. Discussion: this analysis in a randomized trial found no significant differences in costs between RPD and OPD up to 6 months. From the 2026 August 3 edition of Nature Medicine. Background: antibody-drug conjugates composed of a monoclonal antibody linked to a payload were designed to deliver high concentrations of cytotoxic agents to cancer cells. Methods: since their inception, a deeper understanding of the mechanisms of action and resistance to ADCs in patients has generated a wealth of advances in the chemistry of ADC constructs, together with rational therapeutic combinations. Results: in addition, the development of multidimensional molecular tools to predict ADC sensitivity, together with the optimal use of new ADCs in early-stage cancers, should contribute to improved outcomes for patients. Discussion: we discuss these opportunities and challenges and predict that in the longer term, the development of diversified ADC libraries incorporating distinct constructs and drug-to-antibody ratios will enable personalized treatment strategies aligned with individual tumor biology. From the 2026 August 14 edition of European Heart Journal. Background and aims: the gut microbiota is a modulator of cardiometabolic disease. Methods: circulating MP levels were measured in independent prospective cohorts of patients with acute coronary syndrome, ACS. Swiss ACS cohort N equals 4787, Swiss cardiac magnetic resonance imaging cohort N equals 150, German ACS cohort N equals 1428, and chronic coronary syndrome. Results: circulating MP was associated with more advanced CAD and with cardiometabolic characteristics including diabetes and elevated high-sensitivity C-reactive protein. Discussion: gut microbiota-derived MP predicted MACE in patients with CAD independently of traditional risk factors and holds promise as a therapeutic target. From the 2026 August 5 edition of European Heart Journal. Background and aims: the incidence of cancer in people with cardiovascular disease is poorly understood. Methods: participants were drawn from the European Prospective Investigation into Cancer-Norfolk study and followed up for a median of 26.2 years. Results: a total of 22,534 participants were cancer-free at baseline. 10,889 participants either had prevalent CVD at baseline or developed CVD during follow-up. Discussion: this study showed an increased lifetime cancer risk and mortality in men compared with women, which was mediated by comorbid CVD. From the 2026 August 10 edition of Nature Medicine. Background: although CD20-directed B-cell depletion has long been used in neuromyelitis optica spectrum disorder, high-quality, large-scale, randomized controlled trials remain limited. Methods: although CD20-directed B-cell depletion has long been used in neuromyelitis optica spectrum disorder, high-quality, large-scale, randomized controlled trials remain limited. Results: eligible participants aged 18-70 years with aquaporin 4-immunoglobulin G seropositive NMOSD and an expanded disability status scale score of 7 or lower were randomly assigned to receive intravenous obinutuzumab beta 1000 mg or placebo. Discussion: clinical trials. Gov identifier NCT 053141010. From the 2026 August 18 edition of Circulation. Background: patients with peripheral artery disease are at high risk of major adverse limb events and major adverse cardiovascular events. Methods: clear outcomes randomized 13,970 patients to bempedoic acid 180 mg or placebo from December 22, 2016 to August 14, 2019. Results: a total of 1,624 of the enrolled patients had PAD at baseline. Discussion: patients with PAD are at high risk of males and MACEs. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Nature Medicine. Background: recurrent glioblastoma is a leading brain malignancy with few therapeutic options. Methods: here we present the complete results of a Phase 1 trial investigating the safety and efficacy of autologous B7-H3 targeting chimeric antigen receptor T-cell therapy for the treatment of RGBM. Results: the 12-month overall survival rate was 66.7% and median OS was 19.1 months from first infusion. Discussion: clinical trials. Gov registration NCT 05241392. From the 2026 August 18 edition of Circulation. Background: in SELECT, semaglutide effects on heart disease and stroke in patients with overweight or obesity. Among 17,604 patients with known atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes, randomization to the glucagon-like peptide 1 receptor antagonist semaglutide significantly reduced the primary outcome of major adverse cardiovascular events compared with placebo. Methods: in this pre-specified SELECT substudy, we evaluated whether baseline hs-CRP levels predicted MACE risk and examined the relationships between changes in hs-CRP levels and time to first MACE, baseline body weight, weight loss, and other clinical measures among treatment groups over time using multiple approaches, including Cox modeling. Results: baseline hs-CRP level, which was similar in the semaglutide and placebo groups, was prognostic of future MACEs. Discussion: in SELECT, hs-CRP data at baseline, and in response to treatment with semaglutide support inflammation as a potential prognostic factor associated with cardiovascular risk in these generally well-treated patients with atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes. From the 2026 August 10 edition of Nature Medicine. Background: chimeric antigen receptor T-cell therapy induces durable remissions in lymphoid malignancies, yet the extent and biology of long-term CAR T-cell persistence in B-cell lymphoma remain unclear. Methods: Here we report the persistence and characteristics of 4-1BB co-stimulated anti-CD19 CAR T cells up to 10 years after infusion in 38 patients with non-Hodgkin lymphoma. Results: long-term persisting CAR-19 cells exhibited a predominant double-negative, effector memory-like phenotype associated with increased aerobic metabolism and T-cell activation programs. Discussion: clinical trials. Gov registration, NCT02030834. From the 2026 August 11 edition of Circulation. Background: Chagas disease, a neglected cardiovascular condition, affects 7.5 to 10.5 million people worldwide. Methods: we conducted a prospective study embedded in the telehealth network of Minas Gerais, Brazil, across 107 municipalities in hyperendemic and endemic regions. Results: among 75,779 eligible ECGs, the AECG-PI model was available for 59,154 individuals. 6812 screened positive. Discussion: in this community-based study, an AECG-PI model integrated into a public telecardiology network enabled feasible opportunistic screening for CHD in primary care. From the 2026 August 14 edition of European Heart Journal. Background and aims. The cardiovascular benefits of icosapentinoic acid ethyl ester in MACE reduction might extend beyond its triglyceride-lowering effects. Methods: hypertriglyceridemia was induced in male rats by a high sucrose diet. Results: HTG plus EPAE animals displayed lower circulating TG levels and better cardiac function as compared to HTG group. Discussion: icosapentinoic acid ethyl ester treatment exerts direct cardioprotective effects and ameliorates cardiac metabolic and lipidomic signatures after MI regardless of its circulating TG lowering effects. From the 2026 August 5 edition of Nature Medicine. Background: nightmares are a hallmark of post-traumatic stress disorder, yet pharmacological treatments remain limited. Methods: here we conducted a multi-center, double-blind, randomized, placebo-controlled trial to evaluate the efficacy and safety of dronabinol for PTSD-related nightmares. Results: at week 10, reduction in CAPS-IV-B2 scores was significantly greater with dronabinol than with placebo, between group difference -1.5, 95% confidence interval -2.28 to -0.71, Cohen's d equals 0.65, p 0.001. Discussion: clinical trials. Gov. NCT04448808. From the 2026 August 12 edition of Nature Medicine. Background: triple-negative breast cancer is an aggressive subtype comprising 10–20% of all breast cancer cases and has a worse prognosis than other subtypes. Methods: this open-label, multi-center, single-arm, Phase 2 clinical trial evaluates the safety and efficacy of ivosartan combined with chemotherapy as first-line treatment in female patients with locally advanced unresectable or metastatic triple-negative breast cancer who have not received previous systemic therapy. Results: triple-negative breast cancer is an aggressive subtype comprising 10–20% of all breast cancer cases and has a worse prognosis than other subtypes. Discussion: clinical trials. Gov identifier NCT05227664. From the 2026 August 14 edition of European Heart Journal. Background and aims. While inflammation and immunity are modifiers of atherosclerosis, immunological determinants of cardiovascular risk beyond the established inflammatory markers, high-sensitivity C-reactive protein and interleukin-6 remain incompletely defined in humans. Methods: a nested case control study was performed within the Ludwigshafen Risk and Cardiovascular Health Cohort, a single-center prospective study of 3316 patients. Results: the integrated analysis strategy revealed immunological signals not detectable with conventional biomarkers, including a prominent signature of cellular proliferation, linked to activation, memory formation, clonal expansion, interferon signaling, and cytokine secretion in T cells. Discussion: multi-omic profiling of blood immune cells revealed novel immune signatures associated with CAD, short and long-term cardiovascular disease outcomes that are independent of systemic inflammation and may be used as risk stratification tools in the future. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 12 edition of European Heart Journal. Background and aims, to assess the prevalence of subclinical coronary atherosclerosis and its association with myocardial infarction, death or myocardial infarction, and clinically driven coronary revascularization in asymptomatic women and men in a Danish general population cohort. Methods: asymptomatic women and men 40 years underwent coronary computed tomography angiography. Results: from 40 through to 80 years of age, women had less subclinical coronary atherosclerosis than men, both in persons with and without cardiovascular risk factors. Discussion: for the same degree of subclinical coronary atherosclerosis, women may have a lower risk of myocardial infarction than men. From the 2026 August 17 edition of Blood. Background: minimal residual disease status is widely used to assess depth of response and predict outcome in multiple myeloma, but bone marrow MRD testing is invasive and subject to sampling variability. Methods: blood-based mass spectrometry, which measures patient-specific monoclonal immunoglobulins, offers a non-invasive approach to monitoring residual disease. Results: at all time points, MRD negativity by any method was associated with longer progression-free survival, with comparable landmark prognostic performance across platforms. Discussion: the Cassiopeia trial is registered as NCT02541383. From the 2026 August 6 edition of Nature Medicine. Background: psilocybin-assisted therapy may be a promising new treatment for treatment-resistant depression. Methods: we examined the feasibility of administering a single 25 mg dose of psilocybin or placebo with psychological support in a randomized controlled trial design with 6 weeks of follow-up. Results: the adjusted between-group difference at week 3 on the MADRS was -10.41, favoring psilocybin, which was sustained at week 6. Discussion: UDRA CT number 2018-00357-397. From the 2026 August 18 edition of Blood. Background: deep vein thrombosis is a major cause of morbidity and mortality in critically ill patients. Methods: randomized comparisons with SCDs revealed no systemic biomarker differences, indicating that RCD effects were localized to valve endothelium. Results: DVT clots typically form in the sinus of the deep venous valves and are strongly associated with immobility and reduced venous flow. Discussion: these results extend our previous findings by identifying endothelial shear-dependent signaling in response to OSS as a critical mediator of DVT molecular pathology and establishing targeted hemodynamic modulation as a potential strategy in a novel model of human critical illness. From the 2026 August 18 edition of Blood. Background: polycythemia vera is characterized by erythrocytosis and increased risk of thrombosis. Methods: IMPRSSION. An ongoing Phase 2A randomized open-label study includes patients meeting 2016 World Health Organization criteria for polycythemia vera, requiring greater or equal to 3 phlebotomies within 6 months of screening and greater, or equal to 1 phlebotomy within the last 12 weeks. Results: polycythemia vera is characterized by erythrocytosis and increased risk of thrombosis. Discussion. From the 2026 August 5 edition of European Heart Journal. Background and aims. In the relationship between periodontitis and coronary heart disease, the mechanistic role of subclinical atherosclerosis remains incompletely understood. Methods: data from the Swedish Cardiopulmonary Bioimage Study were linked to national registers for dental data and CHD incidence. Results: among 2956 SECA-II participants, severe periodontitis was present in 6% and was associated with severe CACS and severe CIS, with the strongest associations among individuals without concomitant dental caries. Discussion. Severe periodontitis is positively associated with subclinical coronary atherosclerosis, EAT alterations reflecting inflammatory activity, and CHD event incidence. From the 2026 August 18 edition of Annals of Surgery. Background: to examine the association between the timing of surgical excision and survival in severely ill burn patients. Methods: this prospective, multi-center, observational cohort study included adults admitted within 72 hours of injury, with burns involving 20% TBSA across 6 French centers. Results: among 448 patients, 90 underwent early and 358 delayed excision. Discussion. Early surgical excision within 48 hours was associated with lower adjusted 90-day mortality in adults with severe burns, supporting early excision as part of modern burn management strategies. From the 2026 August 11 edition of Nature Medicine. Background: Daraxonrasib is an orally bioavailable ROS multi-selective tricomplex inhibitor of the oncogenic mutant and wild-type variants of N, H, and KRAS. Methods: we previously reported encouraging efficacy in a phase 1-2 clinical trial evaluating daraxonrasib monotherapy at clinically active dose levels in patients with previously treated RAS mutant metastatic pancreatic adenocarcinoma, providing the basis for confirmatory evaluation in the randomized phase 3 RA-Solute 302 clinical trial. Results: here we report mechanisms of acquired resistance to daraxonrasib monotherapy observed through targeted sequencing of over 800 genes in paired pretreatment and end-of-treatment, circulating tumor DNA samples from 44 patients in the phase 1-2 clinical trial. Discussion. Collectively, these results show that most daraxonrasib genomic resistance mechanisms drive reactivation of RAS pathway signaling and guide potential combination strategies in PDAC for further investigation. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. concludes the ConferenceHype weekend roundup of the top medical journal articles of the week. Which study could change practice, and which paper should we revisit in greater depth? If we missed an important article, tag on X and join the discussion. Share this roundup with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe with notifications turned on for next week's journal coverage.